Yeah, there is always going to be with regional anesthesia. I always tell patients that you will feel, it's like being at the dentist, you'll feel sort of like a washing machine in your tummy.
Hello, everybody. Welcome to today. We've got a special guest on today, Sarah Mahmood. She's a senior registrar in gynae and obstetricians in the Liverpool Women's Hospital. And Sarah has recently had a cesarean herself. So aside from performing many cesareans in her work, she's actually undergone her first cesarean. We came in contact just before she had her cesarean, and Sarah contacted me about to be proactive about managing her recovery and using the kit. So, hello, Sarah.
Hi, Kate.
How are you?
I'm well, thank you. I
Good.
feel better after a good night's sleep.
Yeah, I know. It always makes a difference when the babies can sleep. So, Sarah, how far postpartum are you now?
6 months, so 6.5 months. Yusuf was born mid-May.
Right.
Yeah,
Okay.
so it's really
And
flown.
and how many children do you have?
Three, Hiba and Ibrahim, are 8 and 4, and they were born by normal vaginal delivery. And then this time I had a planned cesarean section because my placenta was low and
Right.
it had an
Okay.
way.
Okay. And did
Yeah.
you have the baby at the Liverpool Women's Hospital where you
Yes,
work?
I had all of them there. Yes.
Right. And how
Yeah.
was your experience?
Fantastic. It was, yeah, it was a really good experience actually. I had all my antenatal care there and I delivered there all 3 times, and I had, yeah, a very good experience, an excellent experience all 3 times.
Brilliant. Oh no, we hear good things about that hospital. So
Yeah.
considering you knew exactly what you was going to be going in for when you walk into the operation, how was you feeling on the day of your surgery?
I was still quite nervous actually. Doing it sort of, I've done many, sort of hundreds of cesareans over the years.
Yeah.
That I've done this job, but I think being on the other side is it's always a different experience. But this was a very humbling experience, I would say. It really allowed me to empathise with the women that we care for. And yeah, it was, I obviously knew what was going to happen, but it was my first personal experience of it. So, I felt anxious and nervous about it too.
And did you have the screen up or did you request to have the screen down
The
when you
screen
had
was, yeah, the screen was down, so it was lowered when Yusuf was born.
right?
Yeah.
And did
Yeah,
you
it was
know he
lovely.
was having a boy?
No, we didn't know. So it was
Oh,
a surprise.
lovely.
Lovely.
And so
Yeah.
when you had your cesarean, what was tell me about some of the emotions that you were going through. Was you worried was you thinking with your work hat on or was you thinking with your mum hat on?
I tried not to think with my work hat on, although I knew sort of what was happening at each step. So I had a spinal anesthetic, which is a type of regional anesthetic, um, which numbed me from sort of just above the waist down. And so I knew all of the steps, but again, going through it was my first personal experience of it. Going through it was sort of, yeah, I was still anxious and nervous about it, but I trusted the team that were caring for me.
Good. And
Yeah.
when you said you had a spinal, what's the difference? Could you just tell everybody what the difference would be between the types of anesthetic that you could have when you're having your cesarean?
So the vast majority of cesarean sections, planned or emergency, are done under something called a spinal anaesthetic, which is a type of regional anaesthesia, and that involves sort of sitting up in a sort of upright position, and the anaesthetic doctor will put a needle into the lower part of the back, and that will provide anaesthesia, sort of a numb feeling from the waist down. Some women may have a cesarean section with an epidural or an epidural top up, which is where a catheter is left in similar space in the lower back, and that provides anaesthesia, sort of again a block from the waist down. And then some patients may have what is called a combined spinal epidural, and then a few patients will need to have a cesarean section under general anaesthetic. Okay,
Why
somebody's
would
at the
that
door.
be? Why would people have to have one under a general anaesthetic?
So if it's done in an emergency situation where the sort of time to deliver baby is very short and we need to deliver the baby as soon as possible, then patients may need to have a general anaesthetic. If there are any contraindications to regional anaesthesia, then a general anaesthetic will be used. Or patient choice. Some patients may want to be asleep for the procedure, may not want to have regional anaesthesia, in which case they opt for a general anaesthetic too. That doesn't happen very often, but I have had some patients that have chosen that.
Right. Okay. That's interesting to know. I think because my first cesarean was an emergency, I think they
Yeah.
topped up my epidural. Is that quite a common thing
Mm.
to do? Because I'd had
It
the
can, yes, if it's working very well, then the anaesthetic doctor may choose to top it up,
yeah.
so long as there is a sufficient block.
And I
Yeah,
remember feeling my first baby was like 9 pounds 4 when he was born. He was a really big baby. I was 10 days overdue. And I remember from having the epidural top up, I could feel so much more than what I could
yes,
when I had my elective for my daughter that 2 years later. There was
yeah,
like I couldn't feel anything then, but I could
yeah.
feel like a lot more of what was going on, even though I couldn't see it. I could feel
Mm.
think.
Yeah, there is always going to be with regional anesthesia. I always tell patients that you will feel, it's like being at the dentist, you'll feel sort of like a washing machine in your tummy, or
Yeah.
you'll feel the tugging and the pushing and the pressure, but you won't feel pain. And
Yeah, no,
obviously,
I didn't feel pain.
yeah, the anaesthetic doctor would always check to make sure that they often check with a cold spray, and that's because the nerves that carry the sensation of cold also carry the sensation of pain. So if you can't feel the cold spray, you won't feel the pain.
Oh, that's interesting. I wondered why they do that. They kind of spray the
Yeah,
aerosol on you, don't they?
yeah,
Okay, that's interesting to know. Now, another thing that people are always really concerned about and always are interested about is a type of suture, which is a type of stitching that you
yes,
can use when performing a cesarean. Obviously, I think it's up to the obstetrician's like discretion to decide which would be best for the patient. And
yes.
would that depend on their training, or would it depend on skin type, or would it depend on the fact that they might have had previous cesarean births? Like what would make you decide, or what would be the deciding factor really on the method of suture that you would take from an obstetric perspective?
So I tend to use a pretty standard suture, which is an absorbable, um, sort of an absorbable suture that the body will just absorb over time, so they don't
Yeah,
need to be removed. If the skin is, so if a patient has had many operations and the skin is sort of quite fibrosed, then I might choose to use a non-absorbable suture, an interrupted suture that will need to be removed. But most of the time, the vast majority of the time, I will use an absorbable subcuticular suture. That means that the stitch runs just under the skin, so it's not visible on the outside, and
yeah,
it sort of just takes the part of the skin that lies just beneath the bit that we
subdermal,
can
yeah,
see. Yeah, and so it just brings all of that together, and over time, the body will absorb the suture.
right.
Yeah,
And
that's
then
why.
so under is everything so the the layers beneath that, because obviously there are 7 layers
Yeah,
that are cut during the
yes.
procedure. So the surgeons will always stitch every other layer exactly the same, but then the top layer will differ. Is that right? Or would all the layers might
Yes,
differ?
so the uterus is closed in two layers, and that's
Right.
just to make sure that sort of the endometrium comes together, that the scar is brought together properly to aid healing, and then we sort of just oppose the muscle tissue. We don't suture that,
Right.
and then we, depending on sort of the habitus of the patient, we may do a sort of a suture of the adipose tissue, the fat layer, and then close. I tend to then, once I've done that, close the skin with the subcuticular stitch that I mentioned, and that's what I had. I had the subcuticular stitch
I had that
that was
first
absorbable.
time, and then the second time I had the when they removed the wire.
Ah, yes, yeah.
So what
Oh,
type
yeah.
of stitching is that then? What type of suturing is that one then that I had the second time?
So that's a non-absorbable. What did you have the beads on the end?
Yeah, yeah.
Yeah, so that's a proline. That's a non-absorbable suture.
Right. And
It
do you
just
think that
provides
might have been because it was my second cesarean that they did that?
I don't know. I think it might have just been the surgeon's preference.
Right, okay. And do you think it matters or can impact your scarring later down the line on the type of suture that you have?
I think I always find that a subcuticular absorbable suture will allow skin healing, and sort of from I've never had any concerns about the cosmetic appearance of a scar using that method. So it's what I've had, and I think I've healed very well from it. I don't think that there's any, unless you've got a patient with a very large BMI, in which case you might use staples, or as I said, if if the skin is very sort of if the patient's had many procedures in the past, and the skin is quite sort of tough, then I would, and has lost its elasticity, then I'd perhaps use an interrupted, but the vast majority of the time I use the absorbable suture, which I think gives very good results cosmetically as well.
Okay. Yeah, because I mean, let's face it, like everybody wants their scars to heal in the best possible way. And I just was keen to hear what the perspective was and the thought process
Yeah.
was, because obviously everybody seems to have different, everybody has a different outcome, and everybody seems to have different, like, what ways that they've been sutured up. And the question does get asked quite a lot. So, going back then to thank you for explaining all of that about the surgical side of things. Then going back to when, like, I'm just keen to hear about your personal then recovery once you was discharged from hospital. How long were you in hospital for?
So I had the procedure on Thursday, and by Friday afternoon, I had come home.
Yeah,
so just over 24 hours.
Yeah.
Yeah,
and did they, how, like, lots of people are always concerned about, oh, like, they was made to stand up within 5 or 6 hours. What's your perspective on that?
So I had a catheter. So if you're having a cesarean section, you'll have a catheter. And so I had the catheter in, and so I found, I mean, my spinal took a long time to wear off. I was in quite a lot of pain in recovery. So then I had top-up doses of morphine painkillers, and the spinal did take a long time to wear off, so I wasn't able to get up immediately. Once I was transferred to the ward, I think it took me a good few hours to get up. So the baby was born at 9:45-ish, and I don't think I got up until about 2-3 maybe. I sat on the end of the bed, and then my husband helped me up so I could sit in the chair. And then once I was up, then the catheter was removed. Yeah, so then I was able to potter around a little bit around the bed, and that had just then slowly increased how much
That's
I was
good for oxygenation of your body, isn't it? And the blood just getting out and trying to get everything circulated again.
Yeah, very important.
A lot of people feel really worried about doing that, but you just really do have to trust the medical staff. They know what they're doing, and when they're advising you to get up, it is for the benefit of yourself, isn't it?
Yes. So definitely, it's really important to mobilise. Sort of important, as you say, from the healing point of view, but also in terms of reducing the risk of a DVT or a clot so that's a clot on the leg or the lung even. So I always advise patients to mobilise, and so I was very keen to do that with support. So my husband was there to help me, just to slowly potter about and sit out in the chair and just increase it day by day, slowly.
Yeah, it's really crucial that you do that, isn't it? And what was you? I mean, I know that when we've spoken previously, like, you was like, you had no idea really about what you should anticipate for your recovery. Could you just tell me a little bit about your personal experience and how you found it, and compared to what you was expecting really, and versus how it was? And as you said, like, you've had 2 vaginal births and the cesarean, like, you know, I'm just keen to hear your personal perspective on the 2 and the recoveries.
So I was quite apprehensive, actually. I really didn't want to have a cesarean section, but of course I had to, and that's fine. I didn't sleep the night before. Steve and I were awake. I think there's an owl that is, so we live sort of like in a woodlandy area, and there was an owl that kept us awake all night, but we were sort of really excited. And so then we went in at 7 o'clock in the morning, which again,
I was going to say, it's an early start, isn't it, when you have to be there? We had to leave at 5 to get to the hospital for me for my 7 o'clock start.
So we rushed to get the children. We were really lucky that my mum came to stay with us. So we sort of all got the children ready, got them dropped off, and then all the standard checks beforehand. Very excited, but also very nervous because I hadn't had this procedure personally at all. You know, done it so many times, but it's very different being on the other side.
Yeah.
So then the obstetrician just did a scan just to check that the placenta hadn't moved. And it wasn't going to move, but that they wanted her to do that, so she did very kindly. And then I was just amazed actually at how quick it all was, and then it's also sitting there during the check. So before any operation, there's always a checklist that's done, and it was very odd to hear my name as the patient's name. And it was in a theatre that I'd operated.
It was like imposter syndrome, wasn't it? It's like,
yes, it was really odd sort of being on the other side. So then they did all the checks, and then the
What checks
spinal
do
was
they do then,
really
Sarah, then? What
so
roughly?
it was just checking sort of checking that there's the right patient, any allergies, the reason for this, what procedure is being done, why it's being done. The
Right.
team will all introduce themselves. So that's the standard check that's done before any procedure. And then it's just checks relating to sort of, you know, me making sure that I'm okay to have the anesthetic, the spinal block that I had. And I was quite surprised at how quickly it was in, sort of injection. I was sat up, and then I quickly felt my legs go funny. You could feel this rising warm sensation.
Yeah.
So I was like, quickly get your legs up, so they helped me get my legs up. And then within a minute of the drapes being up and all the other checks being done, so we always check that with the spray, as I mentioned, the anaesthetic doctor will always check, but then we do one last check where we just gently use the forceps to pinch the skin very gently and to check that there's no pain. So all of that bit was done very, very quickly. And then within a minute of sort of all of that, the baby was born. And I'd never had any abdominal surgery before, so it was quite straightforward. And then the drapes were lowered, and we saw baby Eustace, which was lovely, actually. I get really emotional thinking about it, even third time round.
Yeah.
That was all really nice. And then I had a bit of pain in my shoulder, actually. And I remember just feeling really uncomfortable. It's my right shoulder, and I don't know if it was just sort of the... Sometimes I get nerve irritation. And so
Right.
and then it was just over really quickly, actually. Very, very quick.
Yeah.
And I was surprised at how quick it was.
Don't they
And then
write on the board, don't they write like point of incision or something, and then baby
yes,
time the baby's delivered? And
yes. So we
mine was
document all
about
the
8 minutes. Yeah.
Oh, yeah, mine was really quick. It was very, very quick. So yeah, all of that. And then from there we went into recovery, and then I had a bit of skin to skin with Yusuf. He wasn't interested in feeding, so the midwife gave him a bit of formula from a bottle. And then I just remember being in a lot of pain. So the anaesthetic doctor came then and just sort of checked everything was okay, gave me some top-up pain relief. And yeah, that was sort of, that part of it from then on was pretty straightforward. I had the catheter in, that was taken out probably say about 6-7 hours later. Then I started, once I was up and about, things got a little bit easier, but I was quite worried about getting up and about, and actually I needed a lot of support in the first, I'd say 24, 48 hours. I think I hadn't anticipated that quite so much.
Yeah, I know. And I think even like sitting up in bed is like
Yes. Oh gosh, yeah, trying to
oh,
breastfeed or trying to sit up. So I had I made sure that I sort of tried not to slump, which isn't easy in hospital beds, but I tried to sort of sit upright and use cushions to support myself. I got one of those BB Hug Me pillows. They were quite
right.
that was useful, actually. And then what else did I do? I made sure that I was regular with the pain relief. So I'd set alarms. My sister-in-law had a cesarean section not long before me.
Yeah.
But Sarah just set alarms, otherwise you'll forget the pain relief. So I set alarms on my phone, and I was having a combination of paracetamol,
Ibuprofen?
ibuprofen, yes, I think I had some ibuprofen. Yes, I had ibuprofen, paracetamol, and dihydrocodeine. And I had them for about 6 or 7 days regularly, and I spaced them out so that I was always getting good sort of pain relief throughout the day, which was useful. Yeah, and then I got one of those, you can get those grabby things.
Yeah.
I know. Yeah,
Like
so I
the
had one
litter
of
picker
those.
upper.
My sister-in-law gave me that, which was very useful because it sort of, you don't anticipate these things, so try and twist to try and pick up things, so that was quite useful. And then I would get
And so
somebody to
is the
help me.
care suit. Our care suit's good for that, for supporting the abdomen when
Yes.
you're...
So just provided, the care seat was really good because it just provided like sort of core support and pelvic support as well, actually. So I started to wear that. I think I was probably just less than 2 weeks postpartum when I felt that the scar was sort of not as tender as it was, and the dressing had been removed. I started to wear that, and it was very good because it just provided that support.
Yeah, and the reassurance, like especially when
The
you've got
reassurance.
3 children, it's like it's not easy, is it? Like people go, you've just got to rest, but actually the reality is mums can't just stay in bed, can they? They can't. And as much as you, in an ideal world, you would, what the bottle's going to fall on the floor, or
Yes.
you're going to be just bending down to sit down and feed the baby, or bending down to go to the
Changing
toilet.
nappies, all that sort of thing. I'm a busybody, so I found it really hard to not do, so I'm always up and about. So I found it really helped with that, and just sort of helped me to feel supported, which was really, really handy. And what I do, yeah. So I had the grabby thing, took regular pain relief. I tried to potter about, and I think on day 3 or 4, we started to go for some gentle walks around where we live. Tried to make sure I was very hydrated. That's very, very important post-op, and also from a healing point of view. And then constipation can be an issue as well, because we use lots of painkillers, and I'd had lots of opiate-based painkillers, which can cause constipation. So again, hydration, mobilization will help with that. And also I take some laxatives, sort of just to prevent, that build up. And so I found that very helpful.
Because that's quite a frightening thing, isn't it? When you've had your surgery and you need to go to the toilet, people are like, "Oh, doing that first poo after you've been to after you've had your surgery and you've been in hospital." So I mean, we always recommend, and I always try and say, to take stool softeners or laxative, because it will.
I think it's really helpful.
The process a little bit easier. And also, when you're all bunged up with needing to go to the toilet, I mean, that's going to give you a tummy ache anyway, on top of the pains that you've got going on. So you just want to try and eliminate any kind of possible
definitely
discomfort. What about any trapped air? Did you have any of that? When you mentioned about your shoulder before, I was thinking, I wondered if that was trapped air.
Yes, possibly. No, I didn't. I think with the mobilizing, it was sort of like the walking around, making sure I was hydrated, and using, I think it was Laxido that I use. It's lots of different ones, but I used that, and I found I was fine, actually. Yeah, from the recovery point of view, all of those things helped.
Right. Okay. And that's good to know. And then did you you obviously started doing your massaging as well, didn't you? Was that around 5 or 6?
Yes, I probably did 5 to 6 weeks. I think it was 5 or 6 weeks I started to do that with the oil in your kit. And that was, again, before then, I'd sort of gently just touch the scar. There was a bit of fear, I think, with touching it with me. And I think other women have said that they felt the same way. So I just gently tried to touch it. The sensation was altered, and it still is a little bit, but that can be normal. And then I started to gently massage it once the incision had healed. I started to massage it, and I still do that now, and it helps. I did find that over time, the appearance of the scar has improved. It sort of flattened the scar, and also regular scar massage will help with all the layers underneath, and sort of reduce the chances of adhesions developing, and also just sort of mobilize the tissue, the layers under the scar as well.
So that the fascia can move more, glide like the rest of your body.
Yeah, rather than it being really tight.
Yeah. Oh, that's brilliant. And when you, I don't know whether this is something that people do, whether the doctors do recommend it. Is that something that, obviously, we're trying to educate and inform women, that making sure that you incorporate like a recovery plan into your post C-section or 4th trimester routine is really important for your long-term health, because it can prevent a plethora of things from happening with your pelvic floor health, and even down to incontinence, and like you said, adhesions are forming. What is a regular sort of like advice that people are given when they leave hospital, and how do you think that it can change or can improve for women, so that they have a better idea and they don't have to kind of necessarily search for solutions? Because I think
so I don't think, as obstetricians, I don't think we explain the sort of recovery part of it as sort of much as we could do, perhaps. I know personally, I will talk about, well, prior to my own experience, I would talk about just sort of looking after the incision, making sure that it's clean, dry, get some air to it. Things to look out for, like redness, irritation, any discharge, any fevers, or anything that you're worried about, come back to triage, because that will need to be seen. Aside from that, it's sort of like bladder care as well, making sure that you're emptying your bladder irregularly, sort of from the point of view of talking about constipation as we have, reducing the straining, because that can affect sort of the pain and the healing. Aside from that, I didn't do very much, so that's why I contacted you, because I was worried about all the, I sort of, from from the point of view of the job that I do, later down the line, we see ladies who have come back for other surgeries that have had a history of cesarean sections, and the scar tissue can make it difficult to operate and increases the risk of sort of organ injury or other complications. And so I was very keen to proactively, improve scar healing and tissue healing. So I think for me, it was, the things that we've mentioned: hydration, mobilization, scar massage. I've also done some postnatal Pilates, which I think has helped to strengthen my core, because that area felt quite weak, weaker than it did after I'd had two vaginal deliveries, actually. So I found it quite helpful to do all of those things. And I still massage the scar now and find it helpful, because it's flattened the scar and just improved the appearance of it. It's also, I did feel that the skin around it was quite tight, and now it's a little bit sort of more mobile, which is very good. And then the silicone strips as well. I use the silicone strips, which helped to ease the discomfort. I still use them now, and it just eases the discomfort a little bit. And for me, I think it has improved the appearance of the scar.
Oh, brilliant. I'm really pleased to hear that. Oh, well, it's been so lovely for you to give us your time today. I really appreciate it. And it's just really interesting to hear it from both sides of the
Yes.
of the spectrum. So thank you so much. I'm glad that you're doing well, and I thank you for the advice and your time that you've given today. And stay in touch, please. It'd be great to stay in touch, and maybe we can do another chat maybe in a few months' time, to help with some other points that people might have, or some questions that they might have.
Yes.
So thank you very much, and
You're very welcome, Kate.
we'll catch up soon. Thanks, Sarah.
Okay, thanks.